Well, hello, everybody. Y'all made it to the 350 session. Congratulations. Well, I'm Judge Karen Diaz. I'm a Justice of the Peace in San Patricio County. I'm also a collaborative council member on the Judicial Commission for Mental Health. Our next session is called Violence Prevention, School-Based Behavioral Threat Assessments and the Prevention Practitioner Network. This presentation will use the lens of youth interaction with the judicial system to highlight alternatives to incarceration, early identification of at-risk individuals, and cross-disciplinary collaborations to create safer and more resilient communities. I don't know who wrote that, but that was a tongue twister. So, Dr. Kate Shaw is your presenter, and she is the Regional Prevention Coordinator for the Department of Homeland Security CP3 program. Let's welcome Dr. Shaw.
Hello, everyone. All right, I'm going to try to be as lively as possible, as I know, and I am a morning person, and afternoons are hard for me. So we're all in together. We're going to kind of go through. So can I get a raise of hands? Yes, everyone listen, because I'm asking for participation. Can I get a raise of hands for anyone that knows what behavioral threat assessment is? All right, a few of us. Great. Sorry, this feels like it goes in and out. So what I'm going to talk about today is targeted violence and terrorism prevention, really through a behavioral threat assessment and management view, and we're going to also hit on what we can do as a community and as individuals and in judicial systems and how we're going to kind of come together through this. All right, so we're going to do our legal obligation and have disclaimers. Please know that any organization or certain ideals does not necessarily mean that there is the backing of the United States Government Department of Homeland Security. Okay, so the Center for Prevention Programs and Partnerships, or CP3, as we stated earlier, this is our mission. Our job is to try to increase violence prevention work across the nation. I'm over the state of Texas and New Mexico in trying to build out these programs either through funding, training, public awareness, and different levels of government. I work all the way from the really small cities up to the state levels. I work with private entities, with public schools, with private schools. Anyone that wants the assistance, we are free and we are here to help the best that we possibly can. And really, the thing that I think is interesting is that everyone is part of this. Everyone's part of violence prevention. It is not one person is doing this. It's not just police. It's not just our mental health workers. It's not just our schools. But we have to have everyone in our community on board to make sure that we are able to address and identify those at risk for violence. So we're going to talk about targeted violence and terrorism. So I know we've all heard these terms. I'm just going to define them a little bit more. So targeted violence is that premeditated act of violence that is normally toward a specific group, location, really regardless of motive, and of course violates our criminal laws. Terrorism, on the other hand, is going to be very similar to targeted violence, except for it is specifically to human life, potentially destructive to critical infrastructure, key resources, that really the job is to intimidate, coerce the civilian population, or influence our government. Every incident of terrorism is an incident of targeted violence, but not every incident of targeted violence is going to be an incident of terrorism. Your mass shootings in schools can be very small based, not in the grand theme of being a government agency or trying to change political opinions. It could be a personal grievance that someone is wanting to make a statement about bullying, or just one that has issues with their classmates. So that would still be targeted violence, but it wouldn't really fall under terrorism. So our current threat picture. What we currently are finding in the United States is that there are large different reasons that these targeted acts are occurring. Violent extremism, false or misleading narratives, conspiracy theories are all really contributing to this. I know most of us can get online and see most of this happening. We're not we all can see it occurring every day in what we're doing. What we've really seen is an increase of targets in critical structure, of course, our schools, mass gatherings, LGBTQ communities, faith-based institutions, racial or religious minority groups, government facilities, and now, interestingly, also media areas, especially those with opposing ideals to whatever the person or the attacker feels. This is where I think, and this is what really swayed me whenever I was working in crisis services before I started doing prevention services, into how do we actually address these mass targeted incidences. So the United States spends $115 billion a year for domestic counterterrorism, and the domestic homeland security is well over $1 trillion. However, since 9/11, 57.5% of domestic extreme ideologies were successful in committing violent acts. And a third of the time, mass perpetrators of mass casualty events happen. So what does that really mean? That means we're spending billions and $1 trillion in fortifying our areas, and yet still, from the domestic side, over 50% of the time, violent acts are occurring, and over 1/3 of the time, we're still having mass casualty events. Fortification alone doesn't work. We know this. I know I'm also speaking to the choir up here because we have diversion programs, we have mental health services, we have all of these things that are trying to help people, because we know just locking people up or just locking the doors doesn't always work. From 1990 to 1994, the US averaged 2 mass casualty plots, not attacks, but plots. And then from 2017 to 2021, they averaged 40 a year. These are the ones that make it for this statistic. This isn't all of them. There's plenty that I know of that never make it to the FBI reporting. That's a 1,900% increase. We have a problem. And the reason is that I'm up here talking, and why my whole agency exists, is because we're trying to fix this from a holistic approach, because we know the fortification alone isn't working. We're not getting rid of the fortification, just so we're all clear. We're just trying to add to it, and how else can we help? So, what does the public health approach look like? Can I get a show of hands on who knows what the public health approach is? Great, neither did I. So the public health approach is really how we approach a lot of different things in society. I have a social worker degree and a master's, and I still was unaware that this is what it was called, but basically it's bringing a holistic approach and awareness from a public view, from a primary, so what's going on that leads us to this area, a secondary going, hey, we understand there's a problem and how do we fix it, and a tertiary going, all right, this problem already happened, how can we prevent it from happening again? Really aiming to help everybody. It brings together multidisciplinary experts, and this is evidence-based. So what are we looking at whenever we're doing this? So this is really focused on addressing specifics about social, behavioral, and environmental factors that are going to lead us to violence. Again, it's a multidisciplinary approach, and it calls for individuals to participate really in our communities. Now I'm gonna make this a little bit simpler, and my favorite way to explain this. This is the cliff model. This was the way that someone finally explained it to me after several months, I assure you, of people trying. So you have your social determinants of health. These are going to be, for our people who work with kids, your ACEs, low income, witness to abuse, opportunities, all of these, those social determinants of health. We want to help there. Ideally, our society takes care of individuals there, but we know people don't. So they kind of move forward. Then you have your fence. That's your primary prevention stuff. Your work in areas to make people aware. A great thing for this is smoking. We went with, hey, we know smoking is bad for you. Here's why it's bad for you. Here's the education. Where do they get it? We're going to put warning signs on stuff. It's really that primary prevention where you're keeping people from coming off of that cliff. But we know Some people still do. So then you're going to catch them. This again is you're just trying to prevent that next bad thing from happening. In targeted violence, this looks like a behavioral threat assessment team, which is something we're going to go over here in just a moment. We are here to catch them and be aware, hey, they're showing us signs that they might do something violent. They're showing signs in homicidal ideations. They're fixating on individuals that have done these mass attacks before. They're staking out areas. They're compiling weapons. There are signals telling us something bad might happen. A threat assessment team is there to catch it and go, okay, one, do we have concern? And if we do, what do we do? Because a lot of the times when you have all these warning signs, there's not a legal thing that we can do. They're not breaking the law. They're saying things that are protected. So what do we have as our communities, as our schools, as our mental health providers? How do we help these individuals at that point? And then you have when things fall even through the net. This is your tertiary prevention. In the thought of targeted violence prevention, these are going to be individuals who have already almost committed some of these attacks. We also work with hate groups that are coming out of prisons to go in and try to get other people out of that area, but people who've had those lived experiences. We've also had this in violent interrupter programs, working in hospitals for gang violence and different items like this. So we're going to talk about the pathway to violence. How many of you have seen this before? Anybody? Great. Probably my same people who know threat assessment. So the pathway to violence is really interesting. And for my mental health professionals, the pathway to violence is really similar to suicidality. Whenever you're doing a suicide assessment, you're going to look at the ideations. Are they planning? Are they preparing? Have they done this before? Different things like that. You're looking at the same thing we're talking about, targeted violence and homicidal ideations. You start with a personal grievance. Now, what is a grievance to me, what is a grievance to you, is going to look different. And when we're talking about kids especially, that can look very different. It could be a fight with a friend. It could be a fight with a parent. And then the difference is everyone has grievances. What do we do after that? I have coping skills. I have the ability to calm down, to self-regulate, to talk to other people about what's going on. I'm not going to go, hey, I'm mad at this person, I should kill them. But some people do. And us being able to identify who those people are when they're having those thoughts and intervening before we get to that point is important. Your next stage is going to be research and planning. You're often going to see this in who do I want to hurt? How do I get to that point? If you're looking at mass violence, maybe when are there mass events happening? When is this group going to gather? How can I get into the building at this time? All of those different things. Then you have your preparation. So this is going to be gathering your weapons, finding blueprints to a building, figuring out when there is and is not going to be security, etc. Probing and breaching is really when they're trying to enter. Not everyone does probing and breaching, but this is going to be, hey, can I get in this building? Can I get here and nobody notice me? In some schools that I've worked in, I've seen kids bring in fake guns through their backpacks to see if anything's going to set it off, and then later follow up with real weapons. And then, of course, we have our attack. Now, the pathway to violence is not always linear. There can be times that research happens, maybe preparation happens, and you don't see these other parts. But whenever you're doing an assessment to figure out if we should be concerned or if someone poses a risk, we want to look at what can we find out and what is going on currently. As always, if there is an active concern of safety immediately, please make sure to do that first. But there are other ways. So let's say I did school-based threat assessment for a long time, and let's say you have a student that is expressing homicidal ideations. Maybe they even said they're going to shoot up the school. Maybe they told someone else that, posted it online, different things like that. What made them want to do that? What's going on? One, do they have access? Because we want to make sure everyone's safe. But also, What's happening? Did they say it out of anger? Did they say it to get a reaction? Did they say it to be funny? Because unfortunately, I've had lots of kids that have said it to be funny. What's going on, and how can we assist? I had a student that pretended he was in 3rd grade, and he pretended to shoot with an imaginary gun the school pickup line. And we did an assessment, and I went and did the interview, and come to find out, he had been involved in a drive-by shooting in his home. And the school didn't know. Nobody stopped to ask him. I had already talked to the parent who didn't tell me. And so I called back and said, hey, did your house get shot up at 3 o'clock in the morning? And they're like, yeah, it did, but everyone's okay. Is he still there? Yeah, but it's okay. Like, they're not going to come back. We moved the brother that was the target out of the house. But this student in his apartment is filled with bullet holes. One went into his bed where he was supposed to be sleeping, but he was hiding. And then he comes to school and says and pretends to shoot people, thinking it's okay, thinking this is normal. We can help at that point. We can come in and say, hey, let's talk to him. Let's get him with a counselor. Let's see what's going on. Let's give assistance to the family if we need to. How do we de-escalate that situation? Kids are being bullied. How do we de-escalate them off of that? Someone has a grievance with their job. Maybe they got fired. Maybe it's a job assistance program. But what can we do? What is causing someone to get to that point? And how do we get them off of that pathway to violence? So I've talked a lot just now in assessing. A big thing of that is looking at the risk and protective factors that are associated with individuals whenever we do identify that there is a risk. So your risk factors are going to be characteristics that increase a person's likely to become a perpetrator of targeted violence. And then you have your protective factors, which are going to be characteristics that are going to decrease this likelihood. Neither of these things say, yes, you are going to be a perpetrator of violence, or no, you're not. Again, anyone who does mental health, you all see this as well. You understand risk factors, protective factors. A huge risk factor for targeted violence is suicidality. But someone who's suicidal doesn't mean they're going to go kill everybody. One does not mean the other, but they are things that we want to be aware of and acknowledge, because they're really important later on whenever you're going, yes, I'm concerned. Hey, they have these risk factors. What can we do to help? What can we do to manage this on the other end? Here are some examples of risk and protective factors, many of which we've seen. Some interesting ones whenever we're talking about targeted violence is institutional trust. This is really interesting when you're talking more from a community or even from a school standpoint. Let's say in a school, whether or not they believe something's gonna be done if they're being bullied. They've reported it, they've going through the process. They said, hey, this is happening to me, I need help. And then nothing happens. What are we doing at that point? What does that look like for us? Because now this child doesn't feel like they can get help. They went through the process and it's not helping them. Versus in society, hey, this bad thing is happening to me, I need help, or the government's going to fix this, they're going to protect us, they're going to make sure this doesn't happen. And then that doesn't happen and they feel betrayed and they think the only answer is a massive incident or violence. Specifically the El Paso shooter. Something that happened with that was interesting in that he felt like immigration needed to be addressed. And in his manifesto, he says a show of force had to be done. Additionally, though, in that manifesto, there was mentions of different environmental factors because he felt like someone needed to do something about the environment. So trusting our institutes to do what they are supposed to do is a big thing and something that we want to try to give in our societies and make sure that we're part of our communities so that way they can trust us and there is open communication. So we're going to talk about school-based threat assessments. Is anyone in here working with school-based threat assessment programs? Great, I love that. So it is required in the state of Texas, which we'll hit on here in a little bit. But NTAC, which is the National Threat Assessment Center, has done research and they find that almost always intervention points are available for students that resort to violence. We also have found that 2/3 of attackers exhibit behavior that other people notice, and in more than half of those incidences, those other people are so concerned that they are concerned for their life or the life of others. That's really interesting because what we often see is that nobody reports it. We're scared. We feel like we're in danger, but what do we do? What we know is that research shows that the most perpetrator of attacks are current students, with over, I believe the last statistic I looked at was 85%. There are clear indicators and warning signs given. On average, 4 to 5 concerns are observed prior to the attack, and most of the time these are peers or teachers. I want to stop here for just a second because whenever I first taught this, I thought it was really interesting because we all hear that. Oh, there's times where people could have done something. We see the videos. Oh, if I had known, oh, they said this a couple years ago. Oh, well, they killed the cat. Those are concerns. Those are concerns we should have been aware of far earlier and should have been able to do something. The Parkland shooter had 19 different warning signs with 4 interventions with law enforcement. Columbine had 15 run-ins with the law before their incident happened. Those are just 2 very large names. I could go on and make this list really long, but that's the reality of it. There are interventions. The research shows us that it's possible to prevent this, which means that there has to be a process to prevent this. They are not impulsive. Someone does not wake up one day and decide to shoot up a school. Someone does not wake up one day and decide to shoot up a building and do mass violence. Targeted violence is preventable. Every research that we've done since 2001 has showed us this is true. If we're aware that there is a plan and that they're not impulsive, that means that there's time to intervene beforehand. The issue is knowing when these things are going to happen and what to look for and knowing the concerns. Breaking the code of silence. This is specific for schools, and then we'll kind of move to adult efforts at prevention will fail if our students are not willing to talk to adults in their schools. What they have found as the #1 prevention in schools for targeted violence is a trusted adult is likely to reduce by 82% the chance of an individual committing an attack at their school. So when I used to do this, that was my #1 intervention. We had a kid we were concerned about. Who is that person? Do they have one? And if they don't, we were going to make one. Breaking the code of silence is important. That see something, say something is important. Luckily, here in Texas, every single public school has to have an anonymous reporting mechanism for these types of concerns. So, what is behavioral threat assessment for those that don't know? Simply, we can put it into 3 different sets. So you have your identify, those individuals that are exhibiting concerning behaviors. You have your gathering of information, so really taking in all of the information you can, talking to law enforcement, talking to your schools, parents, your mental health providers if they're getting services, neighbors, siblings, friends, whatever it is that you can get to figure out what's going on and why the person is where they're at. Assessing whether or not we're concerned, do they pose a risk of violence, and then managing. This is a big spot that a lot of us are missing. All across the country, all across the state, is we've gotten, the people who do behavioral threat assessment have gotten really good at going, yep, that one, we're concerned about them. They're showing us the signs. Here's all the things that have happened to them. Here's what's going on. We know that we're concerned. But what do we do? What is the management that we can do? Because if they haven't done the attack, if they haven't broken the law, what do we have? What are the resources in our communities, in our schools, in our mental health? How are we intervening and how are we supporting these individuals so we're not waiting for that next attack? We're not waiting for them to go do something before we intervene. So a big thing about this is bystanders. Before I go into this, I want everyone to close your eyes and think about a time that you were really upset. You were going through it. And I want you to think about now who knew, who noticed something was off, Did someone call you? Did they feel it? Was it a spouse, a friend, a parent, maybe a coworker? I know my coworkers normally can tell. This is a big thing because I know when I get really upset and I start to shut down, my mom's the first one. I don't even see her that often, but she knows how long it's gone since we've gotten a text or a phone call. She knows. She knows those little changes in my behavior that are going to trigger that, oh, I need to check in. That's what our bystanders need to be, because your friends, your family, your coworkers, those are the people that are going to be able to tell. In schools, your peers, your teachers that see them every single day, they're going to know, hey, something's up. This isn't a normal behavior. This is an escalation. I'm concerned. So educating our schools, educating our society, educating the people in our communities is really important. And not only educating them on what to look for, but what to do. The worst thing we can do is say, hey, we really want you to report. We really want this to go forward. Please help us keep our community safe. And then they report it and we do nothing. So we have to have a plan of what to do, but we cannot do assessments and we cannot intervene if we don't know. And so the very first step is, how do we report this in our schools and our communities, and how are we able to get them help? So this is where a multidisciplinary team is going to come up. So multidisciplinary teams are going to normally be, for threat assessment, are normally based of some sort of law enforcement entity, some sort of mental health entity, and then hopefully you have administrators, you have lawyers, you have faith leaders, medical personnel, all of these people that really keep your society running. When you're like, oh, I want a community coalition to come together, all of those people that you probably want there, good to have on this team in a big sense. These are your people who are going to advocate. These are your people who are going to be paying attention. In your schools, it's already required, but they're really great to have as support. Any institution that can also create their own. So lots of cities have their own threat assessment team. Lots of schools have their own threat assessment team. Then you have county ones. Then you can have state ones. You can go further and further out. You can have multiple counties all working together, especially in our rural areas. This could be very beneficial just for resources' sake. All of that's very important, but we also have to make sure that our staff is trained. So this is a very, very high level of a very long training I normally do, but here are some things whenever we're assessing what's going on with an individual that we're looking at. Their risk factors, their triggers and stressors, their warning behaviors that could signal imminence. I know especially my mental health providers that know suicide also know imminence is really big and important here. And then what are the mitigators? We're really good at going, oh, that's bad, that's bad, that's bad, that's bad. What do they have that's good? What do they have that's building them up? What do they have that we can build on and help them with? This is a really great visual that was created, I guess, in 2021 that I really enjoy, that was created by one of my mentors actually in this space. So a good way to think when you're ever doing an assessment, this is for management, is looking at, okay, what is weighing down on them? So that's going to be everything up top above this roof. What do they have that's a problem? So maybe it's abuse and neglect, family dysfunction, poor supervision. Maybe individually they have unhealthy or their mood regulation's an issue. Maybe they don't have access to resources. So all of these stressors that are putting down on them. And then think about what are their protection. So for me, I know I have a great family. My pillar for my family, strong. I can't thank them enough for all that they've done. Individually, I've gone through lots of counseling in my life, and I think I have pretty good coping skills. And I'm able to have good insight and understanding of what's going on. And community, I have a great community in my job. And I volunteer. I feel good. I have good pillars. But do our kids, do our other individuals in our society, when we're assessing people, what are their pillars? And if they only have one, maybe it's their family and something happens to their family. Now all of this stuff that's being pushed down now that there's no more pillars. So what are we going to do? So whenever we're making an assessment or building out management plans, what can we do to build the pillars? Because the goal for a threat assessment is not to just stop the incident where it's at, but to build enough into that individual that they're going to be able to continue without our assistance. So we've given them enough tools that they've built these pillars and can continue on. I'm not going to lie to you and say that they're all done really fast. I had cases that I monitored for 4+ years, but a lot of the cases don't take that long and can be eventually weaned off within a couple months. Okay, so in practice, this is just really important and why everybody should know about threat assessment. So the Texas Education Code 37.115 does require school-based threat assessments in all public schools and charter schools. There's a lot of other things that this code requires, especially by reporting, parent notifications, safety for the reporter, etc. But this is all very important, and if you don't know it, you should, especially anyone working in juvenile, public health, any types of mental health, because this is going to come up. So then the Texas Behavioral Threat Assessment Intervention and Prevention Program state strategy was just released in September by the Department of Public Safety here in Texas, and they are establishing community-based threat assessment programs across the entire state of Texas, and they already have 21 set up. And the goal is to have every single one set up. This is the state initiative. It's really just got pushed, and it will be funded fully after hopefully our next session. All right, so we're going to go through all of this in the next 7 minutes. So the ENTER program, the ENTER is the Department of Homeland Security's threat assessment training process. You can use this beautiful little QR code. Go to the page. But you can also become a master trainer for threat assessment in your area if that is something you would like to do. I am also a trainer and can assist you, but this is a week-based program that you can go to. They also have wonderful one-pagers, assistance, research, etc., based off of threat assessment from a national view. NTAC, which I already covered earlier, is your National Threat Assessment Center. This is the U.S. Secret Service. Again, beautiful QR code that other people may see. They are wonderful. They're really good if you have a case at a very high level that you would like to be reviewed, if you have a team that you have built that you would like to be assessed as well, to say, yes, this is working, no, it is not, or they also will come out and do trainings. We do have one based here in Dallas, but he does cover all of Region 6. If you see something, say something. We've all heard it a million times. I know I have. This is also with DHS. If you need assistance in establishing an anonymous base for reporting in your city, you're more than welcome to. Texas does already have one. It is called iWatch Texas, and it is a statewide one. However, many cities, especially your large metroplexes, often do build out their own as well. As the important thing is to make sure that that information and those reports do kind of go to the same place, so we're not have a whole bunch of people trying to do the exact same thing and don't know that the other one's doing it. Targeted Violence and Terrorism Prevention Grant Program, that is from our office of CP3. This is the fun part where I get to tell all of you that we give money. So if you would like assistance in building out threat assessment programs or violence prevention programs in your communities, that is something that we fund. We should be opening our application in the very beginning of May, and details for this grant will come out in January, probably towards the end. But if you have any questions, I can send you all of the information beforehand, or you can go to that beautiful webpage, but my email is going to be at the end of this. Interventions. Invent to Prevent is a wonderful program, especially for those that work with our schools. This is a program that allows high schoolers and college students to work and receive funding, as well as hopefully some scholarship opportunities. And they build out their own prevention work in their current school, their current community. We've had some really amazing programs come from different ones. The only group here in Texas that has made it really far was Texas Tech. They were 3rd in the entire nation in 2022, so we're all very proud. But this is really great. They've come up with different things of how do we check in with each other, how do we establish cohesion and connectiveness in trying to do prevention. There's suicide items with this, there's digital awareness. Kids have done some really amazing things, and this is televised every September. All right, the Prevention Practitioners Network. So anyone in here who is licensed or a mental health provider, this is a really great tool for you and all of my people who don't do that but do need help from people who understand threat assessment and do understand this work. The Prevention Practitioner Network, or the PPN, is a national network site for individuals who understand and know how to treat those who are on a pathway to violence. What I have found in doing this work, especially with schools and with law enforcement, is that a lot of the time our mental health people have not been trained for this. And while our office is consistently working with a lot of different agencies to get that training up and running, and that is a training that we offer in small doses because we're still establishing that process, this is a link for people who do know what that is, who do have the skill set for this type of treatment, and are one of these people who know. Please go on and register, get on this network so people in your community can find you and ask for help. This is their directory. Again, a beautiful QR code for everybody in the audience if should you need it. I'm going to hold it for 2 seconds. Okay, and this is my information. I am Dr. Kate Shaw. I'm a licensed licensed master social worker. We'll figure it out. And I am absolutely here to help. If any of you in your communities need help, I cover the entire state of Texas. I am happy to help. Threat assessment is one of my very favorite things to do, but if you have other community initiatives for violence prevention, please let me know. I am a free resource to help you, and with the grants, I'm also happy to help you there. So, do we want to do questions, or are we good? Okay. Yeah. So she asked regarding an incident of a student that happened fairly recently of a school shooting, that if the report had come in and the district or the city had not done anything, is there something that the federal government can do to intervene? So it's going to be a yes and no, depending if we know, essentially. So let's talk about iWatch Texas, for example. So iWatch Texas goes to all of the local fusion centers, which is a base where they hold information and intel, and it goes to your federal partners, your local partners, all of those. So in that case, we could possibly be notified at a federal level. Currently, a huge group that is doing a lot of threat assessment work is the FBI. They're doing a great job, especially my partners here in Texas that are establishing these teams. So they are involved in a lot of our school-based ones that have reached a certain level of concern. The big thing is someone reporting it to that level. And so if there's not I kind of covered earlier, if there's not that awareness, it's hard to kind of intervene and be able to do something before something like that happens. But that case was very, I know exactly what case you are, and normally when I do a long presentation, I do a case study on that one.
Yeah, and I guess you have the tension of people having their rights until it's actually dangerous, right? I mean, that's something that's constantly, you guys are fighting, but okay, anyone want the microphone?
Well, we're doing it by time, so I'll be out in the hallway. If you have any questions, if you need any information, please email me. If you want to give me your card, I'm happy to email you and will help you in any way that I can. I thank you all for coming.